Hello, this is Joseph Manacop, and this is my video for on how to administer IV push through the primary IV line with the medication. We're going to skip first and second. I'm just going to verbalize that I did the first and second med check on a patient. So we'll be right in the patient's bedside, introduce ourselves, do a hand hygiene, confirm patient's name and date of birth on the patient's wristband, confirm if the patient has any allergies, explain to the patient what kind of procedure we're doing. We're just going to give or administer digoxin per doctor's orders. And we're going to explain here in a few minutes what digoxin is for if the patient does ask. So we're going to do our third med check. Confirm, like what we said, confirm patient's name and date of birth to the MAR. Patient's name is Henrietta Green. The medication is for digoxin, 125 micrograms IV push. I got the digoxin here. We have available is 0.25 milligrams in a 2 ml vial. 0.25 milligrams, half of that is 125 micrograms. And it comes in 2 ml vials, so we're only going to give 1 ml, which is half of the 0.25 milligrams. So I have it on 1 ml of digoxin. So it's 0.125 milligrams IV push one time, and then it's now. So after doing the med checks, other things to consider too, patient privacy, close the door curtain, raise the bed to a good working, comfortable level for us and for the patient. What else? I think that's about it. And then make sure you have a clean working area. We're going to do hand hygiene, and we're going to don our gloves. I got the purple gloves today. I'm just going to verbalize that I'm going to close the roller clamp. Okay, we're going to pause it real quick. After pausing that, we're going to check the patient's IV site. Make sure that there's no infiltrate and there's no swelling, any redness, any check for the skin temperature. If it's cold, normally if it's infiltrated, it's the solution that's making the skin cold. And you can also ask the patient if they are lucid enough, if they're having any pain on the site. After assessing that, we are gonna scrub the hub. So we're gonna look for the hub that's closest or distal to the IV tube and proximal to the patient's IV site. We're gonna choose this. I didn't bring any alcohol swabs, but we're gonna verbalize. We're gonna clean it with alcohol swabs. I actually have some sodium chloride here. After scrubbing it, I'm going to hold it with my non-dominant hand. I'm going to kink the tubing. We're going to insert the saline. And we're going to aspirate. If you find a little blood at the end, which means it's good, you're going to inject a little bit of it. After injecting that much, let me get my trash can here. We're going to inject about 5 mLs of sodium chloride. Okay, slowly. After injecting the sodium chloride, we're going to remove the flush. Uncap the digoxin since there's only 1 ml. We're going to clamp the tubing again. There's only 1 ml. There's much, but I'll just give half of it. Place the syringe in there. Inject a little bit of it. Oh. And make sure you check the patient, see if there's any adverse reactions that you can actually tell and see with the patient. And then just slowly finish up the dose. Remove the medication and discard it. And the remaining 5 mLs, we're just going to flush it. Slowly. Oh, again, wet. And we'll just remove that. Discard. Unkink it. And you open up the roller clamp for the IV to continue. You document what you did, basically, and then put the patient back in a position of comfort, reassure the patient, and discard everything in the trash. Make sure you give the call light to the patient, and you document at the end with the medication to the digoxin, a little bit of information. It's antidysrhythmic. It's used for either chronic or acute congestive heart failure, AFib, atachy, cardiogenic shock. They do not, the contraindication for it is what's that sinus syndrome? Carotid sinus syndrome, or second or third degree heart blocks. You can give it IV, IM, or orally. Some assessments prior to giving that medication, you have to check for 1 full minute the patient's apical pulse. Make sure it is not, again, it is not below 60 beats per minute. If it is below 60 beats per minute, you have to make sure you note the rate, the rhythm, and the characteristic of the heart rate. You got to inform, or you can wait for an hour and recheck it, and if it's still below 60 beats per minute, you have to inform the doctor. You got to first check 2 things. You have to check for labs. You got to check for the patient's electrolyte levels and EKG, and continuously monitor the EKG and the lab results. The normal level for digoxin is I think it's 0.5 to 2 mg or ng per nl. What else? I think that's about it. Watch for signs for digoxin toxicity, like diuretics can give patients dig toxicity. Beta blockers may decrease the heart rate. and other anti-dysrhythmics. And other than that, that's my video for administering digoxin or any medication through the primary IV line. Thank you.